Hi, this is Dr. Doerr for Functional Soft Tissue, and this is video 4 for Condition of the Month for Sacroiliac Dysfunction. And today what we're going to do is our rehab exercises associated with sacroiliac dysfunction. We're going to demonstrate 3 of them today. They're going to be relatively basic startup exercises. However, the important thing to know is that we can obviously progress these to much more challenging exercises by either adding resistance or starting to make them more weight-bearing. So the first exercise we're going to demonstrate is going to be a single leg bridge associated with the left posterior ilium. So what we're going to be doing is keeping our right leg bent, considering the left side is our PI side, usually our right side is our AS side. So we're going to be using our glute and our hamstring to contract and help bring our right side posteriorly. And on the left side, we're going to use our hip flexor and our quad by keeping the leg straight to rock the posterior side anteriorly. So the first thing that we're going to do, as with any bridge, is first of all tighten up the stomach, rock the pelvis backward into our neutral position, and now he's going to bridge up. And the important things here is when he comes up, he wants to make sure that he keeps the legs parallel with themselves. They want to be very even. You don't want the leg coming flexed up higher or dropping down lower. And now we can slowly bring this back down and then relax the abdomen and the pelvis. So this is actually a very tough exercise. As he comes up again, we're going to tighten, rock up. This quad and hip flexor are firing very hard to keep that leg straight against gravity, and on this side, this is where all of our bounce is coming from. Our glute and our hamstring are contracting a lot harder in order to contract and maintain that pelvic position. Come on back down. So that's our single leg bridge. Now again, this is for a left PI. Remember that when we have sacroiliac joint dysfunctions, it's really important to understand that we have asymmetries within our muscle balance. Hence, with that left posterior side, we'll contract the anterior musculature to help rock it forward, and on the AS side, we're going to use the posterior musculature to help pull it backwards. So that's going to be our bridge. Our second exercises, these are a little bit easier again. We're going to start with a simple ball squeeze to contract the adductors. So we're just going to place, we have a yellow TheraBand ball that we're using, the mini ball, and all our patient's going to do is a very tight squeeze, holding it for a few seconds, and then slowly relaxing. Now this is something that we can do, again, sets to 30 we like to get up to, but anywhere from a 2-second to a 5-second hold based on our patient's ability. And once again, we're going to squeeze and relax. So that's our simple adductor ball squeeze. And then one of the last ones we'll do, which is a non-weight bearing, again, these are all done, so to speak, table exercises, is we'll do a supine clam. And what I tend to do is I just wrap that band down around the leg so that it doesn't slip on the patient. And what he'll do now is the supine clam. He's going to keep those heels locked together, tighten up again, and slowly open up the knees, and then slowly bring them back in. Now we can do this in sets of 30. If this is too easy for a patient, we can always do sideline clams so that we actually get more of a contraction on one glute versus another. But these are more of our cinching up muscles. In other words, the adductors as well as those pelvic stabilizers for abduction. These are ones that are going to influence more of stabilization rather than the rotational aspect of the pelvis, hence why we're doing them bilaterally. We can eventually go to more progressive exercises. One of the most complicated ones that we do in the office is actually on the treadmill. So again, this is going to be a higher level functioning patient. We'll attach TheraBands to the legs in different directions. So for instance, if we're talking about the PI side, we're going to attach the bands from the ankle towards the back of the treadmill, so they have to constantly pull forward against the resistance to stimulate more of that quad and hip flexor. And on the opposite side, we're going to use the bands that are going to start from the front and pull and attaching to the ankle, so they have to pull back against resistance. And that will be associated with the glute and the hamstring. So we can do something that's more weight-bearing and create our asymmetrical pulls to stimulate more of a posterior chain or anterior chain musculature. Once again, I'm Dr. Doerr for Functional Soft Tissue, and this is video 4 for Condition of the Month for sacroiliac joint dysfunctions. Hope to see you at a class soon, and remember, if you're looking for any information, just go to www.functionalsofttissue.com, and please like us on Facebook. Look forward to seeing you at a class soon.